Okay, guys. Hi everyone. Good to be on this video and try to give you a little bit of an explanation in relation to what Mako Robot arm-assisted joint replacements, and with an emphasis on the knee side of things. So, just as a summary, robot-assisted joint replacement surgery using the robot arm essentially combines 3D technology with CT imaging to allow the surgeon to construct a surgical plan that is tailored to that individual patient. So, what this means is that before surgery, a scan of the hip and knee is obtained, which allows the surgeon to identify what's the correct size and alignment and shape of the joint should be for that individual patient. Because for all of us, the joint is individualized to us. What this technology allows is patient-specific implant positioning. So really, from a surgical perspective, we know that 3D planning is far better than two-dimensional planning when you want to try to identify the correct alignment and the correct size and shape for individual patients. So what happens is during surgery, sensors are placed around the joint. So in the knee, we put sensors through pins in the thigh bone and the shin bone. And what that does is allows the robot and the software to detect that joint in 3 dimensions. So that's known as registration of the joint by the software and the robot. So you get to learn how this is done. And during surgery, what happens is that the robot arm enters the surgical field, and the surgeon manipulates the robot arm, and the robot arm makes cuts that are precise to fractions of millimeters. So with such precision in the cuts, it means for patients, less pain afterwards because the cuts are so precise. There's less soft tissue damage because less soft tissue releases are necessary during operation, because we know how precise and accurate the cuts are with the robot arm assistance. And preliminary studies have shown that this translates into quicker recovery and less pain for patients. So what I would say is that the robot arm assisted technology has given surgeons and the surgical team so much more information than was previously available to surgeons. So if you look at how conventional joint replacements are done, it is done with jigs and eyeball and making cuts, and this is entirely acceptable, and I still do that. But with robot arm assisted technology, with the robot Mako system, the information that's provided to us is far more. So we're able to balance the knee. So what that means is that we know exactly where the implant should sit, not just in one position when the patient stood up, but it's balanced so that we know precisely where the implant should sit throughout the range of movement of the knee. So that position varies or is different, or is different for different range of movement of the knee. But what we know now with the robot is exactly where to place that implant. So it's balanced. The knee is balanced in relation to the optimal position of the implant throughout the range of movement, whilst at the same time we are ensuring that the knee is stable, that the kneecap sits exactly where it should sit. So what we know as what's referred to as patellofemoral tracking, and that's optimized throughout the operation. So it's not the robot performing the operation, it is actually the surgeon being guided with the robot Mako arm, which doesn't allow the surgeon to make or take more bone off than is necessary, and allows you to very accurately and precisely position the implant. So what I would say is that this technology is accelerating or facilitating the trend towards more minimally invasive surgery. And that means procedures like partial replacements, where in the past we may consider total knee replacements. And we know that partial replacements are far more friendly to the patient in terms of preserving the soft tissues, the bone is preserved, so patients recover quicker. And that's what they want. They want quicker recovery, they want better function, they want a shorter hospital stay, and they want quicker return to work. And this appears to allow us to do that with confidence. And that's the big advantage of the Mako robot-assisted joint replacement surgery. Okay, so I look forward to seeing you all in theaters with this new technology. So remember, to summarize, it is 3D technology combined with CT imaging. It allows surgeons to very accurately and precisely reconstruct the joint, do the knee replacement, and have the confidence to know that technically the operation was performed to an optimal fashion. You know, you don't have to worry about how it looks like on the x-rays afterwards, because we know that the knee is reconstructed exactly according to the patient's anatomy. And this really reassures patients. This technology really reassures patients in relation to how well the technical approach to surgery was, and allows surgeons to then focus on their rehab. And we know that rehab is just as important after surgery, regardless of whether it's robot-assisted technology or not. Okay, all the best, everyone, and see you all soon. Thank you.
Our knees are the largest joints in our bodies. They're central to almost everything we do. So if you or a loved one is suffering from arthritis or an injury to the knee, everyday activities such as walking, sitting, or kneeling can feel debilitating. One possible treatment option for knee pain is total knee replacement, a procedure that involves removing the damaged bone and cartilage, then replacing the knee joint with an implant to reduce pain and restore the motion and function of the knee. Meet Mako, a robotic arm-assisted technology used by surgeons to perform total knee replacements. This unique technology helps surgeons provide a personalized surgical experience, where each surgical plan is based on a patient-specific diagnosis and anatomy. And in a laboratory study, Mako Total Knee enabled surgeons to execute their plans more accurately, while also protecting soft tissue and ligaments from damage. Let's take a look at how it works. It begins with a CT scan of the knee joint. A CT scan is a series of X-rays taken at different angles that can help surgeons see things that they can't typically see with an X-ray alone. The CT scan data is used to generate a 3D virtual model of the patient's unique anatomy. This virtual model is loaded into the Mako system software and is used to create the personalized preoperative plan. Prior to surgery, the surgeon reviews the plan size and placement of the implant, and if necessary, modifies the preoperative plan in order to better position the implant to the patient's unique anatomy. During surgery, the surgeon locates points on the knee in order to register the anatomy in the Mako system. This process establishes the relationship between the patient's actual anatomy in the operating room and the 3D model that was used during the planning process. This step helps ensure the procedure is executed to plan. Once the anatomy is registered to the 3D model, the surgeon has the flexibility to modify the preoperative plan based on their assessment of the patient's anatomy and range of motion. Then, the surgeon guides the robotic arm to remove the arthritic bone and cartilage from the knee. A virtual boundary provides tactile resistance to prevent the surgeon from removing more than just the arthritic bone identified in the preoperative plan. And visual cues, shown in green, appear on screen to show how much bone to remove. Collectively, these cues help the surgeon stay on the preoperative surgical plan. With the diseased bone gone, a knee implant is inserted into the joint space. And once the surgeon is comfortable with the knee's movement, it's off to the recovery room to begin the journey towards strengthening the knee joint.